When a new intervention, that can be practices, products, or policies, is evaluated for its potential to improve health outcomes, the first question is to generate evidence to assess it works and it does not cause unacceptable harms. In the case of an antibiotic, one of the specific intervention research intended to address these questions are, for instance, clinical trials designed to demonstrate safety and efficacy. And that can only be studied under controlled conditions in order to establish that the results observed are caused by the intervention and not by other factors. But once there is sufficient evidence to support the intervention, scientific attention should be focused on how to get the intervention, in our example, the new antibiotic, integrated into routine practice. It then becomes about how we implement what we demonstrated that works, or in other words, how we translate clinical research findings into practice. This is the area covered by implementation research that can be defined as scientific study of methods to promote the systematic uptake of research findings and other evidence-based practice into routine practice as a way to improve the quality and effectiveness of health services and care. It deals with acceptability, appropriateness, feasibility, cost, scalability, sustainability, or coverage, and it is about using systematic research methods to improve policies, program delivery, stewardship, and knowledge translation. It needs to take into account the context, so to understand the barriers, and it implies working within real-world conditions. Implementation research targets populations that will be affected by the intervention and therefore requires working with relevant stakeholders and implementers to identify the needs and to conduct the research. To summarize, it is important to consider how evidence-based programs work in the real world, as explained before, as a way to reduce program costs, improve health outcomes, and decrease health disparities in the community.